Question number 1. What is pharmacology? The right option is option B, study of drugs and their effects. Question number 2. The branch of pharmacology that studies drug effect on the body is called. The right option is option A, pharmacodynamics. Question number 3. Which of the following best defines pharmacokinetics? The right option is option C, what the body does to the drug. Question number 4. The first pass effect occurs mainly in the. The right option is option D, liver. Question number 5. Which of the following routes of administration bypasses the first pass metabolism? The right option is option D, sublingual. Question number 6. Which route has the fastest onset of drug action? The right option is option A, intravenous. Question number 7. Which is the most accurate method for drug dosage calculation in children? The right option is option C, surface area. Question number 8. Before administering digoxin, the nurse must check. The right option is option B, pulse rate. Question number 9. When a nurse administers medication via the Z-track technique, it is given. The right option is option D, intramuscularly. Question number 10. The standard unit for measuring insulin is. The right option is option C, IU. Question number 11. Antipyretics are used to. The right option is option B, lower fever. Question number 12. A drug that relieves pain without causing loss of consciousness is called. The right option is option A, analgesic. Question number 13. Grapefruit juice should be avoided with which type of drugs due to interaction? The right option is option B, statins. Question number 14. Diuretics are mainly used to. The right option is option B, increase urination. Question number 15. Which of the following drugs is a beta blocker? The right option is option D, atenolol. Question number 16. Which vitamin enhances iron absorption? The right option is option A, vitamin C. Question number 17. An allergic reaction to a drug is called. The right option is option C, anaphylaxis. Question number 18. What is the term for the amount of drug that produces 50% of the maximum effect? The right option is option B, effective dose. Question number 19. Which of the following drugs can cause ototoxicity? The right option is option D, furosemide. Question number 20. Drug tolerance means. The right option is option A. A larger dose is required for the same effect. Question number 21. Which organ is primarily responsible for drug metabolism? The right option is option A, liver. Question number 22. Which pharmacokinetic process is primarily responsible for the movement of drugs from the blood into tissues? The right option is option B, distribution. Question number 23. The time required for the drug concentration in the body to reduce by 50% is known as. The right option is option D, half-life. Question number 24. If a drug has a high first pass effect, which route should be avoided? The right option is option A, oral. Question number 25. Bioavailability of a drug is highest when administered via. The right option is option D, intravenous route. Question number 26. The interaction between two drugs that enhances the effect of both is called. The right option is option B, synergism. Question number 27. A patient is ordered 500 mg of a drug. The available tablets is 250 mg. How many tablets will the nurse administer? The right option is option B, 2. Question number 28. Which is the safest site for intramuscular injection in adults to avoid nerve damage? The right option is option D, ventrogluteal. Question number 29. Which of the following is not a correct technique for administering eardrop to an adult? The right option is option C, insert dropper deep into the canal. Question number 30. Heparin is best administered by which route to ensure proper absorption and effect? The right option is option B, intravenous or subcutaneous. Question number 31. Which type of insulin has the fastest onset of action? The right option is option C, Lispro insulin. Question number 32. Which organ is most affected by drug toxicity due to poor metabolism? The right option is option D, liver. Question number 33. Tetracycline is contraindicated in children because it can cause. The right option is option B, tooth discoloration. Question number 34. Which electrolyte imbalance is a common side effect of loop diuretics? The right option is option B, hypokalemia. Question number 35. Which of the following drugs can cause hypoglycemia as a side effect? The right option is option D, insulin. Question number 36. Drug teratogenicity refers to its ability to. The right option is option B, cause birth defects. Question number 37. What should the nurse do first if a medication error is discovered? The right option is option D, monitor the patient and notify the physician. Question number 38. Which of the following is a right of medication administration? The right option is option A, right patient. Question number 39. The nurse receives a verbal order for a controlled drug. What is the correct action? The right option is option C, refuse and request a written order. Question number 40. If a nurse gives a medication without patient consent, it is considered. The right option is option A, battery. Question number 41. Which of the following nursing actions reduces medication errors? The right option is option C, use the 5 rights of drug administration. Question number 42. Which of the following is an example of a calcium channel blocker? The right option is option D, amlodipine. Question number 43. Which group of drugs is used to reduce cholesterol levels? The right option is option B, statins. Question number 44. The main action of NSAIDs is to. The right option is option B, reduce inflammation and pain. Question number 45. An example of an aminoglycoside antibiotic is. The right option is option A, gentamicin. Question number 46. Which anti-tuberculosis drug can cause optic neuritis? The right option is option C, ethambutol. Question number 47. Which food should be avoided when taking MAO inhibitors? The right option is option D, aged cheese. Question number 48. Which of the following lab tests should be monitored for a patient taking warfarin? The right option is option C, INR/PT. Question number 49. Which of the following is a sign of digoxin toxicity? The right option is option B, tachycardia. Question number 50. Which antibiotic may cause permanent staining of teeth in children? The right option is option D, tetracycline. Question. The drug amoxicillin is classified as. The right option is option A, antibiotic.